Let's have a look at other news making the headlines in matters health. We're achieving universal health coverage is one of the targets under the Sustainable Development Goals SDGs in 2015. Now, 3 years later, Kenya embarked on this ambitious plan under former President Uhuru Kenyatta's Big Four agenda that sought to ensure Kenyans receive health services without suffering financial hardship. Despite its national ruling in 2022, UHC appears to have run into headwinds, leaving its future looking bleak. Our health and science reporter Gloria Milimo looks at how the new regime plans to capitalize on a primary healthcare approach, among other health reforms, to deliver the ambitious health agenda. Make sure to stay tuned for the longer version tomorrow in our health segment, Health Digest.
Provision of quality healthcare is a fundamental right, but this has been derailed over the years by financial issues, whose consequences include paying for health services out of pocket by citizens. However, to ensure the realization of Article 43, Section 1A of the Constitution, the government embarked on universal health coverage, but it has suffered major setbacks.
The Grand Coalition government made an attempt on universal health care, and we didn't succeed. The Jubilee administration made an attempt on universal health care. It didn't work. We are not going to fail a third time.
Under the new push, the government plans to deliver UHC by having primary health care at the center of health reforms.
The 100,000 community health workers across Kenya will now be hired by both the national and county governments to provide the first line of response.
Each community worker will visit at least 100 households every 2 to 3 months to offer basic care.
Their mission is crystal clear: to propel the expansion of primary care networks across the counties, thus fostering a more resilient healthcare system.
As a foundation for and way to move towards UHC, the World Health Organization recommends reorienting health systems using a primary healthcare approach, since it is the most inclusive, equitable, cost-effective, and efficient approach to enhance people's physical and mental health, as well as social well-being.
High-quality people.
Part of the health reforms involves scrapping off the National Health Insurance Fund, or NHIF, which has been the driver for UHC, and replacing it with a social health insurance. The social health insurance, according to the new plan, will deliver UHC via 3 funds that comprises of Primary Health Care Fund, Social Health Insurance Fund, Emergency, Chronic and Critical Illness Fund. As the push to deliver this ambitious health agenda gains momentum, Kenyans can only hope that this time round, the government will deliver on its promise to make healthcare affordable, accessible, and of quality. Gloria Milimo, KTN News.
So now local companies are calling on the Ministry of Trade, Industry and Investment, led by Moses Kuria, to have an inclusive policy and making strategy to incorporate